Hey, it's Roberto Miki again, and we've got another great hand question of the week. It's number 23 in our series of questions for medical students, residents, and fellows studying for the boards or in training exams. Well, let's get to it. Which fact is untrue about the carpal bones? A. Capitate is the largest carpal bone. B. Scaphoid is the most frequently fractured. C. Pisiform is the last to calcify. D. Kienbock's disease affects the lunate. E. Praser's disease affects the hamate. Well, here's your chance to pause the video so you can think about the question and answer it. The capitate is the largest carpal bone. The scaphoid accounts for 55% of the carpal bone fractures. The pisiform is the last of the carpal bones to ossify around age 10. Kienbock's disease, which is avascular necrosis, affects the lunate. Praser's disease, which is also avascular necrosis, affects the scaphoid and not the hamate. So the answer is E. Praser's disease affects the hamate. Praser's disease affects the scaphoid. So I hope you learned something. Hope you enjoyed the video, and we'll see you at the next one. Please remember to like and subscribe to help out this channel.